To the Office of Undergraduate Research Education Series. Today's presentation is on intersectionality and research methods, and our speaker is Dr. Tashelle Wright. This is a virtual event, so it is being recorded. We ask that everyone mute themselves and turn off your camera for the best experience. If you have any questions, please use the chat feature or unmute yourself when invited by the speaker. This is the QR code for the event evaluation. We hope everybody completes that after the presentation. But particularly the Europe scholars need to complete that in order to get credit for attending this event. We wanted to let you know that the mission of the University of Utah Office of Undergraduate Research is to facilitate and promote undergraduate, student, faculty, collaborative research, and creative works in all disciplines throughout the University of Utah campus. In recognition that excellence requires diversity, we pursue this mission through equitable programming that promotes diverse representation and social justice. And we acknowledge that this land, which is named for the Ute tribe, is the traditional and ancestral homeland of the Shoshone, Paiute, Goshute, and Ute tribes. The University of Utah recognizes and respects the enduring relationship that exists between many Indigenous peoples and their traditional homelands. We respect the sovereign relationship between tribes, states, and the federal government, and we affirm the University of Utah's commitment to a partnership with Native nations and urban Indian communities through research, education, and community outreach activities. And now I'd like to turn it over to Dr. Tashelle Wright. She's the Associate Program Officer for the Tobacco-Related Disease Research Program.
All right. Well, thank you so much, Shelley, for that beautiful introduction. And thank you so much for sharing the land acknowledgement. My name is Tashelle Wright, and it's an honor to be here with you all today. I am really excited to be presenting on intersectionality and research methods for our education series today. And if you have questions or comments, please feel free to use the chat, and Shelley will be helping me monitor that. I'm excited to answer questions at the end, but if you do have a burning question or comment, I think there may be a raise hand feature, and I'd be happy to answer those as well. So to get started, I wanted to just tell you a little bit about me. So this will help, situate what I'm going to be talking about when we think about intersectionality. So for me, I am a proud half Ghanaian individual. So my dad is from Ghana, West Africa, and my mom is from here in the United States. So growing up, it made a very unique experience living here in Utah, but it helped me understand the work that I do and working with very, very diverse communities from an early age. I also had the opportunity to do an amazing project in Canada, doing a postdoc after I finished my graduate studies, and that was really interesting. So when I talk about my research, when we think about setting and geographical location, these sort of things are really important to the work that we do. Also a little bit about me. I am a proud community college alumni. Not a lot of people talk about that, but I started at Salt Lake Community College. I had the opportunity to transfer to Westminster College, where I was a McNair Scholar. And that's really what I learned what research was. When I was growing up, I had no idea what is research. I didn't know what a PhD was, that was for sure. And I really thought I would just be going into nursing, which is an excellent field. But I learned a lot more about research methods that I'll talk to you about today. Being here in Utah, I decided to go to graduate school somewhere else. And I chose the University of California in Merced, which was an amazing opportunity. Very rural, semi-rural environments. And I really, really enjoyed being there, getting a little step out of Utah and learning more about other health sort of implications, learning more about how to work with individuals who are from Indigenous and immigrant populations. And so that's an amazing experience I had. I then did studies at the University of Toronto in Canada, which was absolutely fantastic. And most recently, I was in the School of Medicine for quite some time. I did equity, diversity, and inclusion work, which is near and dear to my heart. And then I had the opportunity to do some health equity work with the amazing Dr. Kola Okuyemi, who is still the chair of the Department of Family and Preventative Medicine. So if any of you are interested in medicine, please feel free to reach out anytime, and I would be happy to connect you. And last but not least, I am currently at the tobacco-related disease tobacco-related disease research program, and that is with the University of California. So I work remote, but I still do a lot of work here in Utah as well on a community level and on an academic level. Lastly, I wanted to just share a little bit. I think, when we go into research talks, we go straight into the details, but I wanted to quickly show you again, thinking about intersectionality and who we are in this space. I wanted to show you my motivators. So my motivators have really helped me with my research, my son, my sister, and my cute husband. And they actually are super influential in my journey and helping me understand more about intersectional experiences of people that I've worked with. And again, different languages, different demographics, different age groups. So I do a lot of awesome research. One thing I learned is I went into this field really interested in nursing. Then I studied neuroscience because I was very, very passionate about aging and Alzheimer's disease. But along the way, as an undergraduate and then as a graduate student, I had so many different projects thrown my way. And a lot of it had to do with who I am, being someone who identifies as an Afro-Latinx individual, an Afro-Latina. So a lot of folks were like, hey, we could use your expertise. So I've done a lot of projects, and some of my favorites include working on projects that are for Afro-Latinx individuals here in Utah and California. I do a lot of community-based research, and I'll talk a little bit about that. And I got to work with an amazing mentor of mine on LGBTQIA2S plus health. So there's so many different projects that I've done, and I just absolutely love it. And intersectionality ties into them all. So I've kind of gone over a little bit about who I am and what I do, but I'll quickly share that there's some great work going on at the U, not only with the those of you who are involved with the Office of Undergraduate Research, which is so fantastic. I wish I had that resource when I was an undergrad. There's health equity work a lot of health equity work happening if that's something you're interested in. I have a really cool project that I do on Black feminist sociology, which has a lot to do with thinking about intersectionality, sociology, and the experience of those who are interested in studying Black feminism. And then here in Utah, I do a lot of work in the community related to Black, African, and Afro-Latinx health. Also, I'm sure we've all seen this image before, intersectionality. There's so many different aspects of it, and I absolutely love it. And although it can seem complicated, it's absolutely ideal and important to understand who people are and where they're coming from, and not just based on race or class. So yes, and that includes things from marital status to location, occupation, mental health, race, gender identity, and I'm sure these are many different words you've heard of, but we'll continue to talk about those today. In my work, I feel like all of these have come up in different ways, and it's really exciting to explore those with you all today. So many of you may be super familiar with intersectionality, but for those who aren't, I'll just give a really brief overview. So one of my, when we think about people who we really look up to or people who are celebrities in our mind, one of my favorite people is Dr. Kimberly Crenshaw. She has amazing work, some amazing literature out there. And she defines intersectionality as a framework for conceptualizing a person, group of people, or social problem as affected by a number of discriminations and disadvantages. It considers people's overlapping identities and experiences to understand the complexity of prejudices they face. So as we see, there's so many different aspects of a person's identity that can play into their experience in the world, the way they're treated, the way they are perceived, the way they perceive themselves. And in research, it's really important to acknowledge that folks are not just those demographic check boxes that are on the surveys that we've all probably taken many, many different times. So today, thinking about research methods, which is one of the focuses of this presentation, I wanted to go over different research methods that may be available to you. Now, this is a very, very brief overview. So of course, there are a lot more details and we could probably dive into each of these more specifically, but I'm going to just go through a few different methods that people use when it comes to doing intersectional research and the sort of tools that may be available to you and that you may be interested in learning about. Now, some of them are free and some of them come at a cost. So it's really important to explore what's best for you. You may already be using these. And one of the things that I love to do as an educator and as a researcher is learn from other people. So as I show these slides, if you see a research method that you use, or say you're in a lab or you're interested in research that you've learned about that I haven't listed, I would love for you to put that in the chat because there's so many different tools we can use to do research at an undergrad level and beyond. So when it comes to qualitative methods, I really started as a quantitative researcher. I really just used SPSS and SAS for my all day, every day as an undergraduate. But when I had the opportunity to work with one of my excellent research mentors, I learned about qualitative methods and how those can be so transformational in the work that we do. And so now I am quite a qualitative methods nerd. I would rather interview someone, do a focus group, than crunch numbers all day, but it can be really important to have a background in both. So when it comes to qualitative methods, many of these you've probably heard of, and if you haven't and you're interested in learning more, please let me know. But interviews are usually the first that people learn about. Interviews or focus groups. Interviews can be one-on-one. Sometimes you may interview more than one person, but ideally, interviews are often a go-to when we do qualitative work. Now, focus groups are really, really great. They can be challenging when it comes to learning, to taking notes and trying to to catch the nuances that you're learning about. But I really love focus groups as well. In my career, in my life, I've done a lot of focus groups, and they tend to be my favorite for a few reasons. One, it ends up in some ways being somewhat of a support group, not meant to be, right? But when people come together, you can learn so much about their experiences. And often people, once they hear someone else share, they may be willing to share their experience. So for me, I do health research, which can be a really vulnerable topic for individuals, especially individuals that are Black, Indigenous, or people of color. And so sometimes in a group setting, it can either help with that vulnerability, but sometimes a one-on-one interview might be better. So it's always good to explore what's best for your participants, whether that's other students, community members, even if say you're interviewing even like faculty or staff. Now, transcriptions are another piece to that qualitative methods that either folks might transcribe themselves. Many of you may have been assigned that task as an undergrad. I remember when I was an undergrad, I had to transcribe interviews, and it can be super tedious, but you learn a lot along the way. And it helps you really understand the research that's being conducted. Participant observations is also another qualitative tool that I think can be really, really effective and really helpful. Again, most of these practices, though at least the 4 that I listed, may need to be done with an IRB. There is an IRB process where you go through the institution to get permission to do the work that you do. Participant observations can be a really cool tool, especially thinking about how folks interact in their geographical setting, how they may be in, how they are on a daily basis versus being in something more formal like a focus group or an interview. You can learn a lot from that way. Another qualitative method could be analysis of relevant publications, especially if you're looking for like themes, meaning looking for common nuances or common themes that come up in work, or looking for quotes or looking to identify codes. So that may be a process you use. And then surveys is another one. So surveys can be very, very quantitative. So we'll talk about that as well. But you can also have qualitative surveys that have open-ended questions that you can use for your work, for your research, to better understand someone's experience, or say even the evaluation that you all will be doing after this. There may be a qualitative aspect of that to get your feedback. Some of the data tools that I'm familiar with that I think are really, really great for qualitative work. And again, some of these come at a cost. Some of these you can get through the University of Utah, which is great. And then some of you may have access to these through your work or through a lab you might work with. But one of my favorites is Atlas TI. Atlas TI is a program that is definitely more qualitative focused. But for those of you who are maybe interested in a more mixed methods approach, or you're not sure, I want to explore qualitative and quantitative. Deduce is a great tool as well. They have a free trial, so I don't know if any of you ever had time or get that bored, but one of the things I did as an undergrad is just explored the Deduce trial. And it was pretty cool to see how you can log in data, qualitative data, meaning, you can upload transcripts or you can upload other publications and kind of highlight what you want for a project, or for say you're doing a literature review. Qualtrics can be a tool. I think that the university has a Qualtrics license that you may have already used or have access to, that you can get qualitative data that way, especially for their short or long-term answers. Prompts. REDCap is another tool that people may use for both qualitative or quantitative work. And then, of course, when I was in graduate school and undergrad, I have used Excel and Word for a lot of my transcriptions and for a lot of the qualitative work that I did. There's different techniques and different ways that you can do your qualitative work or review transcripts through Word. And a lot of the things I learned were either from really great mentors, other undergraduates. We didn't necessarily have we didn't have an office like this for undergrad research. So I feel like that our office, the Office of Undergrad Research at the U, is a great tool if you need help with trying to figure out some of these tools. Next, quantitative methods that may be used in intersectional research. Most intersectional research, it's really important to determine which method is best for your project. There could be an opportunity for you to do both. So a mixed method study means you're using both. You may have some interview data, you may have some survey data. But there are some researchers who are quite strict to one. They may just do qualitative work, they may just do quantitative work. So it's important to know the sort of methods that your mentor is using, and really try to get a grasp of those. So a few different quantitative methods, that you may be familiar with or have used before is survey data. That could be primary data, so you go out in the field and collect it yourself, or say you create a survey in Qualtrics and you're surveying, all University of Utah undergraduate students. That you might, when you're collecting the data yourself or part of that data collection process, that's that primary data collection tool. Now, when we think about intersectionality, this is where you can really ensure that you are having able to do a better intersectional analysis, meaning once you've collected your data, really be able to pull out some of those intersectional pieces of the work. Sometimes you can do that with secondary data, secondary survey data, or other data that's been maybe handed to you or on a huge database. But sometimes the surveys that exist, or the tools that exist, they're very limited. We'll just use the word limited. For example, a lot of the research we do still just uses the gender categories of male and female, right? Sometimes other, but what does other even mean, right? And so when you're the one doing the survey, or able to create some sort of quantitative tool to analyze, especially using intersectionality as your framework or your lens, you can then add in other demographic variables, other important information that will help you really understand the population you're wanting to report back on, or that you're wanting to understand. And I feel like, with a lot of the secondary data that we have, it's excellent. It's better than having nothing, right? But there's often a lot of limitations when it comes to the sort of demographic data they collect. And so it's really important to think about, what are you really trying to answer? Is a race variable of Black, white, other, Latinx, Hispanic sufficient? Or is it important that, the population you're trying to survey is able to actually describe their own race, ethnic identity? So these are just things to think about with quantitative methods, but they're quite a nifty tool. And for many people, quantitative methods are easier in some ways, right? Because there's a lot of cool softwares and tools, and I'll show a few of those that can really help you analyze things more quickly, where qualitative research can take a bit more time. There's also counts data and other analytics that might be available to you that are more in a quantitative form that you can use to try to report on a project or a study or findings in an intersectional way. But again, it's really important that from the beginning of your project, you identify how is this project going to ensure that I'm speaking to the vast, depending on what you're trying to research and what you're trying to get at, how will I be able to decipher this information from, count data or survey data? So a few quantitative data tools that might that people have used, especially in the circles I'm in when it comes to doing their intersectional research, is SPSS and Stata. Qualtrics can even be used for that, but again, it just really depends on how you format your survey questions. Deduce is a really cool tool as well. And Excel can be a great tool also. And a lot of times, I'm someone, especially as an undergraduate, we don't always have access to the most resources, and we don't have, and sometimes we're kind of, we may have some great mentors and some great individuals in our lab. Maybe we have access to graduate students who are willing to help us, but oftentimes we're trying to figure things out on our own in some ways. So Excel, maybe an R, for example, they could be a really great tool that you have access to at no cost, just to learn or start to play around with some quantitative tools that are available to you. And if any of these sound of interest, or if I've missed any, or there's more you're curious about, please let me know, and I can work with our team, with the Office of Research of Undergrad Research, to get you some resources too. And they probably have a plethora of resources because they're an excellent group. And some of the, thinking about secondary data, again, you can do intersectional analyses with secondary data. Again, it's just really important to be intentional about your research question. And hopefully you've all been through that process. And if you haven't, again, there's resources available to you. But when you're really strategic about how you do your literature review, how you do, frame your research question or questions, or for some of you, maybe you're putting together research aims, that's how you can really ensure that some of these data sources that are available to you really do incorporate dimensions of intersectionality. Some that I've used, or colleagues of mine have used, some of them on a daily basis, are HINTS data, which is from the National Cancer Institute. The census can be used intersectionally, but again, there's some caveats, but there's ways to do it. There's the National Health Interview Survey. For those of you who are interested in health and specifically to Utah, IBIS is a really cool tool that's accessible for you for free. AskGIS is specific to California, but they also have some really, really interesting data available to you. And what's really interesting when it comes to intersectionality, sometimes you're maybe looking, not always are you looking like within one geographical location. So for example, say you're interested in understanding, some, a phenomenon that's happening here in Utah, but also how does that compare to another state like California or like New York, where Jennifer's from, right? You can see what sort of data is available there and how things might differ. And then there's all sorts of other secondary data available to you. Some of these come at a cost, some of these are free. I'm always for the ones that are accessible at no cost. But again, you may work in a lab that has very specific data that they collect, or different secondary data sources that they use. So again, as an undergraduate who is interested in research and the research journey, it's one of the most fun parts of undergraduate is just being able to learn and figure out what is the most exciting method for you, what you could see yourself doing. And so these are different tools for you. So don't be afraid to ask questions of your mentors or the research teams you're part of, to really see what works best for you. So for me, of course, as mentioned, I think intersectionality is super, super important. And the way that I apply it, and I know this won't apply to all of you, but hopefully you can, pick out pieces that work for the sort of work that you're interested in or what you do. And I feel like the examples I'll share now are some research and work that I've done. And I think there's something we can, in some ways, all relate to and find, hopefully find something we're like, hey, I've heard of that before. Or hey, I've experienced that or somewhat familiar with. So for me, when it comes to using thinking about intersectionality, I also use not only do I use intersectional framework with a lot of the work I do, not all, but with a lot of the work I do, I also think it's important in my work to tie those sort of um, how we identify and our lived experience to the social determinants of health. And how does that, again, how does that impact the way that we experience life? How does that impact the way that we go through how our quality of life can the sort of quality of life we might have, the sort of outcomes we might expect. So for me, one of the questions I always think about, and of course with this being more of a live module, I'll just present the question, but just something to think about as you're listening to the next piece is, what is the first thing that comes to your mind when you hear the term intersectionality and health? And I don't know if you all are able to use the chat, and if not, that's okay. But when it comes to intersectionality and health, I think it's really important. The pandemic was detrimental to so many different communities across the world, the United States and beyond. And what we found in a lot of, during this devastating time is that there are so many limitations, there are so many barriers to access to healthcare. And we'll just specifically focus today on the United States because we could talk about several different countries. But here in the US, when we think about how people are treated when they go into health spaces, when we think about, folks are distrustful and they prefer not to go into health spaces, this is where intersectionality can really play a role. Working in the School of Medicine at that time, I think it was really interesting because you have patients who were absolutely suffering, who wouldn't come and until it was like life or death situation. And intersectionality plays a role in that because they've had different aspects of their identity and how they perceive themselves and how they feel society perceives them impacted their willingness or their comfort in going into healthcare. So a project I wanted to share with you that I think is really I think it's relevant even to today, unfortunately, when we think about people's experience in healthcare and how they are treated and perceived. I worked with the amazing Dr. Whitney Pirtle on a project called Structural Gendered Racism Revealed in Pandemic Times, Intersectional Approaches to Understanding Race and Gender in Health Inequities in COVID-19. And in this project, we went, most of the work that we did was looking at research that had come out recently about experiences of specifically those who identify as women and even more so women of color and their experiences trying to access healthcare during the COVID-19 pandemic. And we still see some of these nuances today. So looking at their experiences and how the pandemic really revealed a lot. People were forced to go home, and home was not always a sanctuary for people. Folks experienced job loss. You had unequal burden of, unequal family burden. And a lot of this took a huge toll on the women of color. And it still does, because as we're seeing, COVID numbers are going up again. And as we're seeing, a lot of times when we think about so in this picture, sorry, let me backtrack, are all women of color who are healthcare workers who who were at the front line. Some of them were nurses, doctors, or folks that were taking individuals, who were just there to take vitals or to run labs. And all of them not only had to work, not all of them not only had to work during the pandemic and have exposure to all sorts of different diseases and issues, but they also were caregivers for older adults or other dependents they had. They also, some of them experienced furlough, some of them experienced all sorts of um, issues. And so when we think about intersectionality, it's not just the fact that they were, some of them were Black, Latinx, and a woman. There were so many other layers to their experience that are important to consider. So, structural gendered racism. So, just a little bit of background information on this and why this was important for us to explore. And we're still exploring this now post COVID as well. So, structural intersectionality is the consequence of the imposition of one burden that interacts with pre existing vulnerabilities. So, emphasis on vulnerabilities to create another dimension of disempowerment. And structural gendered racism, or the totality of interconnectedness between structural racism and structural sexism, is shaping race and gender inequities. So, again, we use this as a way to frame the work we were doing to try to analyze the experiences of those who were women of color, those who identify as women of color during the pandemic times and their experiences. And again, many of their experiences were life altering, life changing. Some lost their lives, some lost loved ones. And so all of these different vulnerabilities, we'll use that word, or maybe not, maybe aspects of one's identity, aspects of one's lived experience, all add to one's experience in the world we live in, whether that creates or fosters a beneficial or a successful experience, or something that's detrimental, that's life-threatening, or causes sickness and illness, things of that nature. So again, one of the things that motivated this, which again was by one of my amazing colleagues, Dr. Pirtle, is at the time of the pandemic, there was a shelter at home put in place, right? So this is actually where this project started. Again, when you think about folks who had to shelter at home, there was this idea of who is safe, right? People were experiencing evictions, people were experiencing interpersonal partner violence. There was the overburden of invisible labor, so the sort of work that individuals do that go under or unacknowledged, and this idea of other mothering that really pushed this project forward. Again, it's not just, and again, the importance of thinking about intersectionality is not just, okay, we know that these, certain groups suffer more than others, or experience health inequities more than others, or are more at risk of X, Y, or Z disease or X, Y, or Z experience in the world, but it's also looking at these other layers that impact one's lived experience and health. So for us, it all started with okay, we have to shelter at home. We're hearing more, we're hearing more from individuals who are experiencing all sorts of life-altering events or are stuck in a place where they're not safe. And so how do we acknowledge those aspects of one's experience in order to really make sustainable change? And so that's one thing I think that's really, really powerful about intersectional research, is that it's not just Black versus white. It's not just, low income versus high income. There's a lot of other factors that go into this. So in the article, some of the areas that we highlight, again, beyond just, gender and race, we look at households, we look at occupations, and healthcare institutions, or access or lack of access. And there are so many other areas that are important to explore when we think about intersectionality in health. And so again, apply to your work, whether you're, in the broad health field and medicine, or whether you're in business or education or sociology, whatever sort of educational path you're going down. When you're thinking about the research you're doing, there's always ways to explore other areas that might impact one's experience, or that might help answer questions about, why does X group or X individual experience this and another person doesn't? um, other topics on intersectionality and health that we're working on, and of course, and being mindful of time. There's some really cool projects that we're doing. One of the projects we're doing is on historical trauma, and this is on Black health, and a different project on Indigenous health. And so when you're thinking about just thinking about projects like this, again, it's not just based on race. It's not just based on cultural beliefs. There's so many layers. And I think one thing that the institutions and and academics can really do is think more about just those standard or generic demographic surveys that just get to check this box or rate your health 1 to 5. It's really thinking about other layers. Currently, right now, as you can imagine, there are the country we live in and even the world beyond, there's all sorts of economic issues that are going on. And one of them is access to food and food security. And so right now we're working on a project using census data to look at Black and Latinx communities and access to food, convenient food versus fresh food and organic, access based on class and environment, blocks and zip codes. And so again, versus instead of us just, maybe going out there doing a quick survey, do you have access to food? Have you experienced food insecurity in the last 6 months? We're looking at a lot of other factors. Okay, do they have access to food? Okay, check yes or no, right? Well, what sort of food do they even have access to, right? Because that plays a role in one's health. And then taking it beyond that, okay, understanding class is really important, but also one's lived environment. So they may have access to food, but the environment they live in, that food is not, they may have access to food today, but they may not tomorrow. And we're looking at blocks and zip codes again to try to determine, again, where is the need and what are the sort of experiences people have. Now, this project has a lot of other layers too, but I think that it's really important again to think about not just answering a yes or no question, really trying to, and I think that's what's important about intersectional research is that it's not just, again, a couple check boxes and then that's your demographics and that's your community who you're trying to help. There's a lot of other factors. We're working on projects with older adults. There's a really, really cool project we're doing here in Utah with older adults around mental health. And before we even started this research project, we did a focus group. We did a focus group to determine what was important to them before we just, because we know mental health has always been an issue, especially in communities of color and in different spaces. But generationally, there's some different experiences and beliefs and stigma around mental health. Especially for us, we're working with older adults that identify as Black or African. And so there's all sorts of other cultural nuances as well. So we did a needs assessment to actually help us with our intersectional study. So to help us understand, okay, which aspects do we want to are important to them, not just us as researchers, but we want to have our research be something that's meaningful, something that's sustainable for individuals. And so it's not just up to us. Yes, we may see, okay, this is an ongoing issue in this community group, but what is there more? And so just some interesting things that came up when we did a focus group with seniors, when we were talking to them about some of the things that are important to them. Some of the things that came up are family status. So just losing individuals in their family was something that came up quite often. So loss and grief. They talked about displacement. So some of them lived in different places in the US and beyond, other countries, and they had to come here so that they could they feel displaced because they needed to come and have a family member, be it a sibling, a son, a daughter, sometimes even grandchildren, care for them. And so there's all these different aspects of one's experience that are helping us frame how do we best approach this group when it comes to a mental health and behavioral health project through the lens of their own experience. And then I think another piece of intersectionality that I feel like the University of Utah is actually doing really great at. I've been in a lot of different institutions, and this is not always something that's acknowledged. is, folks who are experiencing certain disabilities, whether that's physical or mental or cognitive, or those invisible disabilities we just don't see. And so we're working on a project as well in conjunction with some of our Black and some Latinx seniors on disabilities. Again, physical, mental, cognitive, or invisible. And again, beyond just like, okay, tell us about your experience, or going in and saying, okay, tell us about your experience so we can create some sort of intervention. We are learning about them from multiple layers. What is, beyond just who are you as an individual, race, class, SES, that social economic status. We're learning about, their family, their family dynamics. We're learning more about their, how they identify, what part of their identity is the strongest for them. Is religion the most important thing to them? Is health even important, or are there other priorities? And so those are some of the things that we're working on. I just thought I'd share a couple different works that may be of interest to you, may not, that also talk about intersectionality in different ways. So we have a long research paper, but we also have a blog piece that's a much quicker read if it's something you're interested in, that explores, again, some of the ongoing concerns that the pandemic brought to light. Concerns that have always been there, but the pandemic really, really brought those to light more for the world we live in and society as a whole. The pandemic reveals homework and healthcare disadvantages for women of color is a piece that we rewrote for Gender and Society, if you're interested. Again, thinking about intersectionality and the sort of gaps in care, the gaps in education. I worked with the amazing Dr. Cephas, who's a psychologist. He's also at the U. He's a Black psychologist. We recently did an episode on distrust in healthcare, and we talked about, again, some of the aspects of medicine that get ignored when it comes to individuals of color seeking care or being cared for with respect and dignity. And a lot of it has to do, again, with their identity or how they're perceived right when they walk into a clinic or a hospital or a dental facility, or even to go, for example, get your eyes checked. All these aspects of healthcare and achieving the best health you can. We talk about this on an episode with Roots, Race, and Culture, but we also have a podcast episode as well. And I'm watching the time. So one of the things I want to end with, and again, I could go on and on about different projects or different studies, but I wanted to keep it somewhat introductory and then share a little bit of research with you all today. I do want to acknowledge the community members in California and Utah who shared their experiences with me. I don't think I would not be the researcher I am today if it wasn't for people being willing to talk about some really uncomfortable and vulnerable experiences they've had as, Black and Latinx and some Asian individuals in the United States who don't have access to healthcare, don't have access to a lot of things that we often take for granted that we often take for granted. And I also, of course, want to thank the Office of Undergraduate Research for the opportunity to present to you all today, learn more about your program, and also, for being willing to work with me when things were rescheduled. So, of course, if you'd like to connect with me, please do. I would love to hear from any of you or all of you. And so I'm going to leave time for questions.
If I could just go ahead and say something, thank you, Dr. Tashel Wright, for joining us. My name is Dr. Annie Isabel Fukushima. I'm the Associate Dean of Undergraduate Studies. Good to see folks here. I also want to acknowledge, because our humble friend is super doing a ton of stuff, and lots of accolades to Dr. Wright, but I'm going to drop in some links, and I just want to share that Dr. Wright is also the Transformative Intersectional Collective Research Fellow, and you can see the announcement here. And so wanted to just also say thank you so much for the wonderful work that you do as a transformative research intersectional fellow that is funded by the Mellon Foundation. And also wanted to convey to folks that if you're really interested in learning more about intersectional intersectional inquiry and research. On November 2nd, the School for Culture and Social Transformation has organized an event called Intersectional Inquiry Research Across Difference, where we'll bring some of our folks who, like Dr. Wright, have been a part of our initiatives and also fellows to talk a little bit about their work. So we hope to see you all there at that. But I just want to thank you for sharing so much of your own journey, as well as how you think about methods from a qualitative perspective. I think this is incredibly rich, and the real societal impact of this kind of research on our communities. And so just wanted to make sure I had a chance to thank you. And then now I'm going to punt it over to Shelley, who is going to take the reins. Thank you so much, Dr. Wright.
Do any of the participants have questions for Dr. Wright?
I would like to ask a question while our participants start to think through maybe their questions, but I'd love to know, Dr. Wright, if you could maybe talk a little bit about what makes using an intersectional method and framework challenging. And so how do you get through that? Because actually, you know, I think people think it's just, we add 3 categories of difference and then we go, we're done, right? But we know it's not so simple. And actually, I think the kind of complexity of your work is very clear. And so I'd love if you could maybe talk a little bit about how you get through some of the challenges of employing such a complex frame, because one of the things that we know is that oftentimes as we start to think about people's complex identities and how they intersect and cohere in their everyday lives, is that things start to get more complicated. And so, yeah, can you talk to that a bit?
Yeah, thank you for the question. Dr. Fukushima is right. There's a lot of challenges to this work, and you're right. I think I put it way too simple. It is more than just adding some questions to try to, learn more about an individual. When it comes to doing, intersectional inquiry, intersectional analyses, there are quite a few more layers as you start to see how identities intersect and how that it can it can create some level of complication in the way that, for me, I'll speak from my experience. For me, especially being in the spaces I'm in and trying to be true to this research, is ensuring that we aren't, when we try to understand the role of different identities, how they play out, how they impact individuals, to ensure we're not speaking for people. And so I think that's one of the challenges, right? So the idea is we want to understand people more holistically versus just, what's on paper or what sort of, boxes are checked off. And so I think one of the challenges, at least that comes up a lot, is yes, we now have this information. We may understand, like, okay, this individual, we'll just use a recent example. This person, this individual may identify as Black, transgender, uninsured, homeless. What does that mean for their experience? And how do we, as either clinicians or researchers, really, one, try to best acknowledge those pieces, acknowledge those identities that individual carries, but also understand how those interact and intersect, and what sort of resources or intervention it makes sense, because it's not a one size fits all. And so I think what's challenging is to, once you have all different layers and different intersections, how do we then ensure we're not going back to the original, okay, well, they have 1, 2, or 3, and this intervention has been proven or works or is, has been validated. So let's just try, let's use this approach. But how do we be more intentional about the sort of interventions or implementation work that we do? And I will say it's still a work in progress. I'll be honest with you. I still feel like I'm learning all the time. I still feel like with the, it does present several challenges where the we have really great intentions as researchers, but not always, especially if you're working with, say a dimension or an identifying factor you're not as familiar with, just being willing to ask questions, willing to, for me, it's one of the most valuable pieces of the work I do is working with and within communities. So not just, going to different population groups and, partnering with them to complete surveys or do interviews or focus groups, but they're part of the process from the beginning, working, having different community members or people who have, who are experienced different folks in the intersections being at the table, leading conversations, helping us as researchers understand what does this mean for them and what can we do, what sort of, how can we facilitate different, either, again, how can we, what can, I'm trying to think of the best way to phrase this. What are the facilitators and barriers and what is our role in that, and how can, with their guidance and with their expertise, so the individuals or the communities that we work with, having them lead these efforts has helped with some of those challenges. I would say, I'm not sure if I answered your question, Dr. Fukushima. It is complicated, so I feel like I'm processing it. I'm processing it as I talk.
I love it. I think it's wonderful. And I'm going to share with the group that you're also talking about community engaged research, and we have some other content on that if they want to kind of pursue that. I just love that there's so much richness in what you're sharing about how one approaches intersectionality and how they think about people's lives. We're complicated, aren't we? That's super awesome. So I just wanted to say, that totally answered the question. Thank you for navigating through it with us. Thank you.
Yeah, thank you so much.
Well, thank you again, Dr. Wright. We completely enjoyed this presentation. Everything you've done is very impressive, and we're thrilled to have you present to us today. Everybody, the evaluation form, I'm dropping the link in the chat. And please, the Europe scholars, please complete that in order to get credit for attending today's event. And we have recorded this, and it will be available online next week, or if you want to review it again. So thank you again, Dr. Wright. We appreciate it.